So the health T levels are aimed at students that would like to get into any healthcare roles. This could be with the NHS or in the private sector as well. There's so many different roles that they get into. There's like over 350 different types of roles within the NHS itself. So yeah, any students that are just looking to look after people and get the best out of their health. For the occupational specialism for adult nursing, their practical sessions will involve looking at supporting patients with their activities of daily living. So this will be anything that they carry out in their day-to-day life, like getting dressed, going to the toilet and eating and drinking. So just really supporting those patients to be independent in doing those tasks. They may also look at skin integrity, so checking that a person hasn't developed any pressure sores or wound care and things like that. And yeah, just generally supporting the health and well-being of a patient. As part of the health T levels, the students get to complete a 315-hour work experience placement. This is a mandatory part of their course, and they generally get placed out in the NHS trusts. We're really lucky at Cirencester College to work really closely with 3 of the trusts in the surrounding counties, and there's other placements they can get placed at as well, like in the community, and they get to apply all of their practical skills that they have learned in college and take that out to placement, and also get exposed to all the things that they would come across if they were working in the industry. It's really helped the students with their university applications, and we've got plenty of feedback from the university themselves. Really impressed with their level of knowledge and practical application at this stage. It's really helped set them up and gain entry into higher education. The T levels are assessed in a couple of different ways. They have a couple of just standard type assessments for the theory and the science that they need to complete, looking at like human anatomy and physiology. And then there's also some practical assessments, so they get to apply all their theory into practical skills scenarios. They also have some practical assessments where they can apply their theory into practice, and they have to carry out a number of different scenarios. They might be looking at a patient that's come in with some chest pain, and they have to carry out some observations on that patient to escalate their care so they get supported. And they all sort of take place at the end of the second year, so they're generally assessed at the end of the second year for these T levels. On the T level, we have many different guest speakers that come in and talk to the students. There's loads of different roles within the NHS itself, so we get quite a few a variety of different guest speakers that come in and talk about those different roles and how they got there, what the working day-to-day life is like for each of them, and it really does provide a really good insight for the students to different career options that they may take. Because when they first start, they don't generally have an idea of which pathway they want to go into, so those guest speakers just provide them with that industry experience. And we also go off to several of the universities. They host a taster day, and they can get involved in different choices at the university as well, and again support their decisions in where they want to go after the T level. Most of the students have gone on into higher education, so they've gone off to uni to study adult nursing, midwifery. We've had some paramedics. We've also had a couple of physiotherapists and occupational therapists as well, and radiography. And then there's been a few students who've gone on to get some apprenticeships as well, so they've taken a bit of a longer route into it, but gone on to do nursing associates as well. The best thing about teaching at Cirencester College is watching the students come in quite quiet and not very confident at all, and then as soon as they go out into placement, their confidence absolutely rockets, and they come back and they tell me everything that they've been getting up to in placements. It's just really nice to see and hear what they've been up to, and watching them apply everything we've taught them into practice as well. It's really nice, and absolutely love results day when they get their results, opening the results and getting where they need to be.